On this episode of Message Meg, we hear a lot about women and menopause, but what about men? Men experience hormone changes too. That's called andropause, and it can drain energy, affect mood, and impact sexual health. So, is hormone therapy the solution? In the final part of our series on hormone replacement, a leading urologist separates fact from fiction and breaks down the real benefits and risks. The conversation starts now on Message Meg. While we hear a lot about women and hormone replacement after surgical or natural menopause, we know that men have questions about their waning hormones as well. It's called andropause, and it affects their bodies, their mood, sexual desire, and performance as well. So, do men need hormone replacement? Well, here to answer all those questions is Dr. Neil Baum. Now, he practiced urology and urologic surgery for 44 years. He has authored several books on health and managing your medical practice. He also has 250 peer-reviewed medical articles. And here's your latest book right here, Men's Complete Health Guide, with illustrations and everything about everything they want to know. Now, one of the things I've always liked about you is your ability to not only a good doctor, but to explain things just very simply to people. And I remember one day we were doing an interview and you looked in the camera and said, "Men, the day you put down the cigarette is the day you have a stronger erection." You were talking about blood flow. So you tell it like it is. So let's start, first of all. Men, I was reading where men are at the peak of their hormone, the testosterone, around 17, and as early as 30 and 40, it starts to drop off. So what happens with andropause? It's not like women who it's kind of right at a certain age, it goes away. What happens?
Well, let me start by taking the misinformation and the myth out of the word andropause. That sounds so medical. Let's just call it male menopause, because this condition that we're talking about, low testosterone, impacts a man just like a woman who has a decrease in her hormones, estrogen. And so we'll call it male menopause. And what happens, you're correct, around the ages of 17 and 20, that's when we are our most robust. And that's when our hormones are raging. And then it's unlike women who have an abrupt decline in their hormone level around 45, 50-ish, men start to decline so slowly that they don't notice it. It starts at like about 1% a year. It starts to decline so very, very slowly that we don't miss it. Then around the age of about 50 or 60, that's when it kicks in and starts becoming symptomatic, and that's when men start noticing the problem. Unfortunately, most men don't bring it up with their doctors.
Why? Why, Dr. Baum?
There is great hesitation on their part to share their problems of intimacy and the lack of ability to engage in sexual activities. They're kind of embarrassed about it, and oftentimes it's the woman who brings up the issue. And there are so many men who would come to my office, never say anything, and then the wife would make an appointment and she says, "Dr. Baum, I'm going to tell you how it is. And we are having a problem in the bedroom." And unfortunately, most doctors don't bring it up. Women are so much better at organizing health and taking care of themselves than men. And as a result, men get pushed, their symptoms don't get pushed aside, don't get recognized, and it definitely impacts their whole quality of life, not just the bedroom, a lot of other things too.
All right, well, let me just read some of the symptoms and you can talk about it. Decreased libido, that's, sexual desire. Fewish and diminished erections, meaning you may not have an erection or spontaneous erection when you're sleeping or something. Sparse beard growth, shrinking testes, less energy, loss of muscle and bone, and also not only erectile dysfunction, but fatigue, facial hair and body hair loss, hard time concentrating, so it's affecting your brain, depression, crankiness, low sense of well-being, low sperm count, and increased body fat. We know men get the VAT, the visceral abdominal tissue around the belly, which is the cancer, heart disease type
metabolic
effect.
syndrome, diabetes, this all goes into it. And testosterone, this hormone that is produced by the testicles are the source of sperm, and they're responsible for reproduction. And also in the testicles is where testosterone is made. And as men get older, like many other things in our body, these organs don't function as well, or they're impacted by disease, like cancer of the testicle, or overuse of steroids, anabolic steroids. Men who are weightlifters and want to pump up their muscles take testosterone, unregulated most times by their physician, and as a result, they can wipe out the production. When they stop it, the testosterone never rebounds.
Okay, well, so testosterone, let's just dispel this myth. It's not just for having an erection and having sex. It affects your heart, your brain, we said body mass, diabetes, all that. So men, you recommend all through their life should have the right amount of testosterone, whether they have to replace it with hormone replacement, if they don't have their natural testosterone, for total body health, not just for sex.
Okay, there's a word that I want to spend a moment to define. It's called homeostasis. Homeostasis means the body always likes to kind of stay in neutral. And when it doesn't, the body can correct itself. It's an amazing organ. And when there is too much blood pressure, the body tries to correct itself and reduce the blood pressure. If there's a problem with diabetes and the glucose is out of control, there is insulin produced in our pancreas that helps to control. The same with thyroid hormone. If it's too much or too little, the body attempts to control it. However, as we get older and this decreases, there's no production of testosterone that normally takes place. We have to supplement it. And it's necessary that men who think they may be having all those symptoms that you related, and they may be having those symptoms. Usually it's erection problems and sex drive that drives them in, or the partner says, hey, we got to look into this. This isn't going well for us. And they come in and they are tested, and the
blood test. It's a simple blood
test. Yeah.
And you want total and free testosterone? Is that what should be ordered?
Well, if you're working it up, in greater detail, like for a problem of decreased sperm count, yes, you do need both those. But I just say, as a screening test, you just need the total testosterone, and that number relegates or indicates when appropriate replacement is necessary.
Okay, how do we replace it? I know women have injections, they have pellet implants, they have patches that go on your skin, which are all better than oral, because we know you're delivering it not through your liver, not through your gut, you're delivering the hormones just like female ovaries to your blood. So what is the best way for men to get their testosterone replacement?
Interesting. As you went through what happens to women, the options available, there are injections, there are pellets, there are intranasal that you have to use 3 times a day. There are injections that the man can get, and pellets, which are longer lasting, 3 to 6 months. The injections.
Those go under your skin, like in your buttocks?
Right.
And a little fatty tissue,
right,
okay?
Yes, and they're replaced. It's for the man that doesn't, let's say he's an oil field worker, he's out of the country, doesn't want to come back, doesn't want to inject himself. I've gotten a lot of men learning how to inject it themselves. You know, there are so many things today, you know, the glipizide that people use, they can inject themselves and don't have to go. So people are much more comfortable when they're educated on how to inject the testosterone. Yes.
Well, this is an IM, meaning intramuscular. So this is an injection that goes maybe in your buttocks or your hips, some thick, big muscle. Your thigh. Can they give it in their quads, in their thighs, or no? It's more in the hip area.
It has to be a little deeper.
Okay. Once a month?
It's usually every 2 to 4 weeks.
Okay.
And the man will also notice, you know, he's getting it, and a couple days later he feels, you know, energetic. More than a couple days. So it's a week. Feels energetic, and then at the end, when it's wanes, he notices it, and he says, I need more. And then then they give the dosage depending on the symptoms.
Blood levels? Symptoms and blood levels.
Yeah, you do test the blood levels. You know, initially as you're starting, he has the problem. He complains, I'm lethargic, I'm tired, I'm sleeping after meals, and the wife might say, he's a little more irritable than he's been in the past, and that's a common
low T.
Of low T.
Okay.
Yeah, and then he will notice that after getting treatment, whatever it is, and there's all those things from patches to oral.
Gels. There's gels.
Yes. Yeah.
Well, what when a man starts to not have enough testosterone, do his erections not get as frequent or as hard? Is it just not as hard for you know, during an erection for a man?
And he can't hold the erection. You know, the erection subsides sooner than he would like, and before the woman achieves her enjoyment as well. So,
well, psychologically, how does that affect a man when he's not thinking, oh, I have low T. He's thinking something's wrong with me, or maybe the relationship. Well, I know they talk to you about their emotions and psychological side too.
Unfortunately, men don't do that as well as
None of
women.
Them?
Some.
I know women go on and on.
A woman will give it up real easily. A man, a little shy, a little less communicative about the issue, and as a result, you know, it just doesn't get recognized, you know, as well. And like I say, unfortunately, most physicians do not bring this up. They don't say, tell me about your erection. They just don't cover that. And I think women are much more like, let's just take the amount of money that is contributed each year for breast cancer awareness. It's a huge amount. I don't know the number, but it's in the millions. The women are organized, they're getting the word out, and you know, women recognize that they need to have breast mammography, and they've done a great job. Men, not as well. Can you believe the National Football League has the month of October as Breast Awareness Month, and they are wearing, I think it's the pink shoes? Yeah. Now, I can't believe, why haven't the National Football League promoted prostate cancer or testosterone deficiency?
Prostate cancer is one of the top. Well, let's talk about
that. But the
that.
NFL doesn't do it. The women have organized and motivated the NFL to promote this, and they have done a great job.
I'll give Roger Goodell a call and tell him to get on that. Let's talk about prostate cancer, and also an enlarged prostate, which is not cancer. It's benign.
Correct.
So, can men be on testosterone replacement? First, let's go with if they have an enlarged prostate, not cancer. Should they be on there?
Sure, they can take it.
No side effects with that?
With testosterone? Yeah, there's several. But let's just talk about prostate cancer and testosterone.
And can a man have it? Can a man have testosterone replacement if he's had prostate cancer?
Okay.
Or benign?
Okay. Well, first of all, if they have benign enlargement, and that's when the man has difficulty going to the bathroom, gets up at night, and there's medications, for treating specifically the prostate, but also if they have concomitant or at the same time symptoms of low testosterone, they can take testosterone replacement. Now, the issue is, can a man with prostate cancer take testosterone? Years ago, when I was a little bitty urologist, the party line was, oh no, you can't do that. That's like putting gasoline on a fire. That was what they taught in medical school. You can't do that because it'll make the cancer go crazy and it'll spread, and it's inappropriate, wrong, medically not a good idea to give that. Well, now we have found that if a man who's had prostate cancer and radiation or surgery or medication, some of the medications do cause the testosterone to go down. If a man has prostate cancer and agrees to close follow-up with the urologist or oncologist or even a primary care doctor, but it's usually the urologist, if they are agreeable for follow-up, they can receive testosterone, and they monitor them with that blood test called prostate-specific antigen, PSA.
Important for men to get that.
Now that is something, we talk about the mammogram for women. Men need to get a screening PSA after the age of 50, unless they are African American who have a higher incidence.
40 years old for
yes,
them.
Yes, or a family member. If your father had it, your uncle had prostate cancer, you should start screening around the age of 40. Now, after somebody has the diagnosis of prostate cancer, the PSA comes down, it's almost negligible. They can receive, with close monitoring by the urologist, they can receive, and that's acceptable by...
Get their testosterone. Okay,
yes.
Let me ask you, what about a man who's had his prostate removed and they've gotten all the cancer? They should be on their hormone replacement as well if they're in andropause to get their T levels back up?
Yeah, if they're symptomatic. I don't believe that you go to a doctor and that they give you testosterone without being tested. Because if you have normal testosterone and you give it and you boost it, to unrecognizable levels, you aren't going to enhance their problem of bone mass, muscle weakness, lethargy, erection problems. That won't work. And there are clinics that people can go to and they can get testosterone without being tested.
Oh no, you have to know where your level is to bring it to normal.
Exactly,
well,
that's the homeostasis we were talking about.
All right, so I'm gonna, because you brought this up, you said this is not the same as taking anabolic steroids that people use to get big in the gym, which is hurting their heart and causing a lot of other problems, and you hear about the roid rage and all that kind of thing. This is bringing you up to normal.
Correct.
So this is FDA approved. This is totally different than steroids, because is it true that when men just take steroids or too much testosterone, they actually have their genitals shrink?
Yeah, the testicle
and the penis shrinks?
Well,
mostly the testicles.
From disuse, the penis can shrink if you don't get the blood in there and have erections and engage in intimacy. Yeah, it can shrink, like after prostate cancer surgery, if they don't use. There are things that they can do to maintain, penis size, but they have to be monitored, by a urologist, and then it becomes safe, and it improves the lives of these men who will often say, they come and they say, I just don't feel like a man anymore, and that's heartbreaking. when you can do something about it. And we, like a program like this, is going to go out, and not only men are going to see this, but women too. And women will say to their significant other, hey, there's a solution to this. Let's go talk to your doctor. And I think this is wonderful, because it's education that we are in dire need of. The other thing that we're in dire need of is, we talk to women about self-exam and how important it is. And they are educated, how to properly perform.
Find for a breast lump.
Correct, how to find that. And we need to teach young men between the ages of 20 and 40, because that's when testicle cancer is most common. It's really uncommon to discover it in a 70-year-old man. But we need to tell young men about testicle self-exam. Briefly, let me explain it. The normal testicle has make a fist. It has the consistency at the base of your thumb. That's the normal, you can compress it. If, on the other hand, it feels like your knuckle.
Like in the hard, okay.
And that means get to the doctor.
Okay, if the testicles feel hard, do they get a lump on it like a woman?
Yeah, they get a lump.
So if you have a lump, or if it feels hard and not kind of like tissue.
Like you can compress it.
Okay, or if it hurts. I know some men who have gotten testicular cancer and there was pain.
Not
that often. Okay.
Not that common.
Okay. Not that common.
It's usually without pain or discomfort, and it's usually a discovered. And I recommend that men do it once a month when they're in the shower. But somebody's got to explain this to them, and this is not widespread. Because I think women have done a great job of getting out to I'll bet you there are rare to find a woman who hasn't heard about breast self-exam and mammography. And I'll bet rare to find a man who is examining his testicles, young, 20 to 40. And we need to do this in high schools. This is something that needs to be discussed. We need to bring, and this program is...
The mental joke that they don't want to, they'll have the blood test, but they don't want to have the digital rectal exam, that it's, women go every year to get the plumbing examined, so it's the same thing. Dr. Baum, anything else we need to get out to people?
Mainly that this is a condition that is common amongst millions, not hundreds of thousands, not a few, millions of American men suffer from low testosterone. Help is available, and all they have to do is ask for it and share it with their doctor and read my book.
Yes, and read this. This is everything. It has illustrations, I should mention. Dr. Baum, thank you as always. On the next Message Meg, it's a silent virus spread through intimate contact. It's very common, and you may not even know you have it. HPV affects millions, including young adults, and it can cause cancer. There's no cure. But could a simple food supplement help fight HPV and even cancer? A top mushroom expert reveals groundbreaking research, plus an OBGYN clears up the myths and facts. Don't miss Message Meg next Wednesday only on WWL+. It's a conversation you don't want to miss.